You've just finished the 19 learning modules to understand how to conduct the model of care. So what do you do to implement it? The objectives for this lesson are to review how to implement the model of care with MiChoice participants, and to understand how to use the evidence-based toolkit and forms to provide the care to the participants. And we'll also cover and describe how to document in the assessment, person-centered service plan, and progress notes. So your responsibility as a clinician are to complete this certification program online and to use the pocket card that we have provided to determine if care is needed and appropriate for MiChoice participants. So, your goal is to better fit the participant and their environment where they live. Most participants will end up receiving the person-centered service plan by the RN and the social worker, focused on their desires and needs, and in almost all cases, the RN will do a review of the participant's medications. Then you'll need to determine if OT would be beneficial for the MiChoice participant and then provide OT care. You'll also have to determine if additional RN or social worker visits would be beneficial and provide the care. What we have found is that most NIPD and post-hospital or nursing home discharge patients are likely to benefit from OT or increased RN or social worker home visits, in addition to those participants that are highly motivated to improve their function so that they can continue living in the community. You will also coordinate the care team and care for the participant and document in the participant's records. So overall, you have 4 responsibilities. Complete the certification program, determine if care is needed by MiChoice participants, and provide the care, then coordinate care and document in the participant's record. So your role is to have a deep understanding of how to use the new model of care for participants in the MiChoice program. Remember, it's person-centered and self-directed to fit the participant and their environment, building a collaborative relationship and their self-efficacy, using readiness to change, motivational interviewing, cognitive behavioral therapy, brainstorming, problem-solving, and role modeling. You'll also use communication, collaboration, reflection, and interdisciplinary coordination. We have provided a pocket card to guide use of the model with participants. You will assess the participant, co-design with them the person-centered service plan, help them select strategies, and provide the care as needed. You'll also help them enact the strategies and evaluate if they're effective or not and modify them if needed, and document everything in their record. You will print the toolkit and forms and use them where the participant is needed. So here is what the toolkit and forms look like if you need to use them with a participant. We've designed an aging in place toolkit with strategies to help participants manage problems experienced by the elderly or disabled. There are 12 areas that we focus on that are most commonly occurring. 1 is aging in place. 2, balance, walking, kneeling, standing, bending, and reaching. 3, bathing, grooming, dressing, and toileting. 4, bladder control and dribbling. 5, managing and taking medications. 6, memory and forgetfulness. 7, pain management. 8, preparing meals, banking, shopping, and cleaning. 9, preventing a fall. 10, sadness or stress. And then we also added on an 11th, sexual health. These can be printed and used at any time with MiChoice participants. We also provided some information sheets on other less commonly occurring problems. Like, for example, we have the CDC Check for Safety, a home fall prevention checklist. We also have one on dizziness and another on what to expect as you get older. We also have some wonderful chair exercises that a team of clinicians at Valley in Flint helped us design, and some healthy food choices. You can print these fact sheets and use them at any time with any MiChoice participant. We also have a couple forms, if you would like to use them. A medication calendar that helps a participant visualize their medication regimen, an exercise reminder log so they can help know themselves when they need to complete their exercises and can also view their progress. We have the OT assessment and the OT home environmental tour checklist. These can also be printed and used with participants as needed. We also have a health booklet, which helps a participant organize their health information in one place. And they can take this to their doctor's appointments to have an active role in their health. Those that use this have found it facilitates communication with their health care providers. These can also be printed and used as needed. How do we document this new model of care? It's simple, just like you do in the MiChoice program every day. You document in the assessment. The OT is a little different because they have a new tool, the home environment assessment and the participant assessment, but the RN and social worker both use the IHC and the add-on assessments for pain or depression if needed. One new addition for the RN is the app assessment of the medication review, which needs to be downloaded and saved and then uploaded into the participant's record. In regard to the person-centered service plan, you document in the same way as you do in MiChoice. It should reflect the participant's needs and desires, what's important to the participant, their choice of services and supports, which are the strategies, and it needs to be written in a plain language using the participant's words. Most importantly, though, what you need to remember is that you select the strategies with the participant. And also, you evaluate and modify the strategies with the participant if they're not working. And progress note documentation is the same as you do in MiChoice. You do have to document readiness to change scores in the progress notes. This will help you focus your energy and time as a clinician. So, use the words like collaboration, problem solving, and reflection in your notes, and also statements directly from the participant. So this concludes the champion training. We thank you for the time that you've taken to do this learning module, and we hope that you'll begin to use the new evidence-based model of care with participants in the MiChoice program, as we have found it truly has reduced falls, improved their ability to do their IADLs and ADLs, reduced hospitalizations, and most importantly, improved their quality of life. Thank you.